So hello everybody. So today we're gonna be doing a weight loss procedure. So what we're doing today is a gastric sleeve. So I want to tell you a little bit about the gastric sleeve. So the gastric sleeve procedure is a laparoscopic surgery that is done through small incisions inside of the stomach. That's made for you to lose the weight in a permanent way, and you're gonna be having just definitely a complete improvement overall. So just hold on for a second. We're gonna be explaining a little bit about the weight loss procedure. It's a permanent procedure that is gonna definitely change your life forever. So this is the team from Guadalajara. So we're in a weight loss team from Tijuana. So we're in a weight loss team that is performing a weight loss procedure here in Tijuana, Mexico. So the weight loss procedure is for those patients that do have overweight. So overweight would be considered through the BMI. So you have to know exactly your weight and your height to be able to know if you're candidate to doing this procedure. So this is done all through disposable equipment that is done laparoscopically with the best technology, which is stores right equipment, which is right here, which has the best of the equipment that you will see in the hospitals in the United States as well. So we're in the border from Tijuana, right? We're in the border, we're close to San Diego. So we have a program of patients coming in from different states, flying into San Diego. We're gonna pick them up, we're gonna send them directly to the hospital. So right here we're with the nurse technician, the OR technician. So we just loading up the guns to actually shoot them into the stomach. So we're gonna be showing that part. And this video is made for you to explain you about the weight loss procedure. So if you have any questions, you can please ask right now. We're gonna be actually explaining you about the whole process of doing the weight loss procedure. So definitely it's a permanent procedure that is gonna give you the best outcome in the future. And it's gonna be a permanent procedure that is gonna guarantee a weight loss in 6 months. So really close to 6 months, you're gonna be close to your ideal weight. So if your excess weight is something close to a BMI of 35 to 40, you're gonna be having your ideal weight by just doing the weight loss procedure in 6 months. So if you suffer from severe obesity and you're over 40 or to 50, we definitely suggest to do the gastric sleeve. And then in the future, maybe in 6 months to a year, you're gonna be doing the revision to actually complete the process into a bypass surgery. So what's the difference between a gastric sleeve and the gastric bypass? So definitely the difference between these both procedures is that the gastric sleeve is only for weight loss, and the gastric bypass is the gold standard for metabolic diseases, such as diabetes, hypertension, cholesterol, and all these diseases that are gonna be improved better with doing the gastric bypass. So if you are a diabetic person and you've been diabetic for a few years and it's the type 2 and you're only taking metformin, you're going to be able to control it really well with the gastric sleeve itself. But if you're already injecting insulin, you're going to actually need to have a consideration on doing the gastric bypass. So if you like this video right now, we're going to give you a special where to do it on the spot, where to do it actually in the surgery itself of the gastric sleeve. We're going to give you $200 off into a weight loss procedure if you say that you watched into this video and if you liked it and actually share it to your Facebook page. So if you actually share into your Facebook page and you actually like this video, you're going to be able to get $200 off into a weight loss procedure. And if you do that, you're going to be able to come into Biomedical Spa and to get $20 off into injectables procedures. So this is a team of the gastric sleeve surgery. This is a bariatric team based on Dr. Ponce Leon, which is a bariatric surgeon well known in Tijuana, and in hospital INT, which is a really safe hospital to proceed to these procedures. So you have to know that when you're doing a weight loss procedure, you're doing a plastic surgery, you don't have to be in a hospital that has therapy. So intensive care therapy is something that you want to have into your procedure that they will involve into something big like this weight loss or a tummy tuck or something close to those procedures as well. So what he's doing right now, he's basically separating the stomach, just making sure that he gets all the grilling out, and he actually gets into the inside of the stomach, just making it smaller and making it tighter. By making it tight, it's gonna restrict the way you eat, and you're gonna be able to eat only 4 to 6 ounces within the first 3 to 5 weeks. After those 4 weeks, you're going to be able to start living normal. You're going to start being able to eat whatever you want. You're going to start actually being able to actually continue with your lifestyle. And we definitely suggest to change into a better habit. So if you're actually doing good habits and you have the weight loss procedure, you're going to be a success case, definitely and guarantee. So when you're doing a weight loss procedure, you have to have a general anesthesia so the patient is completely out. This patient comes from Los Angeles. She finds us through social media. She trusts us. She actually went through reviews. She actually went into researching the surgeons and making sure that they do hold those board certifications. Having a board certification would actually guarantee success into your procedures, success in the follow-up, and also a nice and beautiful result and a safety matter. So having surgery, it really doesn't concern, right, most of the patients, since you don't actually go through the process without getting a full checked out. When you get your checked out, you're gonna be actually going through your cardiologist here in Mexico. You're gonna get the blood work done by here in Mexico as well, the same day of your procedure, the day before. So they're gonna let us know exactly what they think about you, what they actually find about you, and if we see any risk, we will not proceed to doing the surgery that day. Most of the patients would actually come into a weight loss procedure with a little bit of this control in the metabolic way. We understand that since obesity is an issue. So you have to remember that obesity is not your fault, that actually ghrelin will be creating to your stomach, causing you to actually regain and gain weight. So that's basically a hormone that is released inside your stomach. So what the surgeon is gonna be doing, he's gonna be removing the excess ghrelin that you have into your stomach into actually a short release of ghrelin, which is gonna actually make your weight loss. So weight loss is something that some patients would not be able to actually lose that weight only because they have heavy bones and they do create a lot of ghrelin. So having excess ghrelin into your stomach would actually cause you to eat more, to actually have more tolerance and to insulin, and you're actually going to be creating a second stage diabetes. So diabetes would actually cause you to gain again, and actually just removing that hormone that is produced excessively on the patients that do have excess weight would actually cause the obesity problems on them. So you have to heal that as the same as you would actually have to remove a gallbladder stone, or maybe to remove the appendix, such as things like those. So basically it's an excess hormone that is created and you have to cut and get it out into your body. So it's not the fault of the patients. I know patients that they do not eat a lot and they start regaining and gaining weight just by the cause of gaining. So just fixing that problem would actually success and have you a good guarantee on the weight loss matter and with the weight loss success. So the gastric sleeve will mainly take all the ghrelin out the first year, and then in the future you will create only 20% of it. So the patient would not regain, would lose the weight, and have a beautiful life in the future, to be able to keep up with their kids, to be able to follow up with the appointment with the doctors, and actually do not hold diabetes anymore. So we have we have a lot of success into the patients and for post-op, and we have amazing reviews. So we also offer the service of picking you up from the airport, bringing you here to Tijuana, and actually bringing you to a recovery house. We have the spa, we have the hospital, we have all the management that is needed into the patients coming outside of the state. So we're located 20 minutes from San Diego border, so we're gonna be actually able to pick you up in San Diego airport and bring you crossing the border to be able to have this surgery. It's gonna only take 4 days off from your work. You can come back later after a week, and actually you're gonna be here in the hospital for 2 nights and 1 night at the recovery place. So we have plenty of stories of success on the gastric sleeve. We have a lot of security in our surgeons. We definitely have the whole bunch of certification, and we have a superstar team. So this is a 5-star team, and you can do your research, and only you're gonna have a lot of success, more than 22 years of backup experience. So the weight loss in Tijuana is one of the places that would do more bariatric surgeries on the world, more than even a few places that you will be amazed that we proceed more in those places, and we have a lot of experience in the town. So if you're looking into have a bariatric surgery, Tijuana is the best of the best to have those procedures. So weight loss procedure will guarantee success in a short time period of 6 months with only a few efforts of the patient. So remember, obesity is not your fault. It could get fixed, and doing the gastric sleeve would definitely guarantee the success. So thank you so much for watching this video. We're gonna log out. We'd like to only show you a little bit of the future that he's doing for reinforcement, so you definitely have a blast coming here and a lot of security coming here into bioplastic surgery. Thank you for watching. If you like this video, please click like. It's gonna help us a lot to grow this group and this channel, so we can keep informing you about plastic surgery and weight loss procedures in an easy, understandable language. Thank you so much for watching. We'll see you soon. This is Dr. Sergio Verduzco. Thank you so much for watching, and we'll keep posting some videos in the IG, so keep watching. We're gonna have a lot of plastic surgeries going on right now. Thank you so much, and have a great afternoon.
Thank you.